ladies, and happy International Women's Day. Today we're going to talk about the pelvic floor muscle, which is super important in women's health. It's essentially the muscle that supports your pelvic organs. So that includes your bladder, your uterus and your bowels. And it can be affected quite easily through things like pregnancy, weight gain, maybe a change in hormones. So it's quite an important muscle to keep strong, but also know how to relax it as well. Pelvic floor is a muscle, so it needs to be worked and trained like any other muscle. So staying with that consistency of using exercises to strengthen the pelvic floor muscle, which in turn will then provide you with a greater level of support. Now, what you tend to find is that Pilates is actually a really good form of exercise for strengthening your pelvic floor, because we talk so much about the core and the abdominals and the breath. So you'll find that as you're breathing in your Pilates class, actually you are engaging your pelvic floor, even if you maybe don't quite realise it. But the way to build a strong pelvic floor is to strengthen it like we would with any other muscle. So whilst you can, of course, work your pelvic floor muscle during a Pilates class, it's actually something you can do outside of a class environment as well. So you can start to think about pelvic floor exercises and start to strengthen your pelvic floor whilst sat watching TV, or you might be sat in the car at the traffic lights. Don't try and do it whilst you're moving. That's probably a little bit dangerous, but as long as you're in sort of a stationary position, maybe sat at your desk at work, then you can sort of take a few minutes just to incorporate the exercises into your daily life. So when we think about the pelvic floor, it's actually a muscle that runs in a few different directions. So it goes from the front of your pelvis and runs all the way back to your tailbone. So think of sort of a hammock shape. And then from there, it also runs out to the side, so to your sit bones. So these bony bits that we sit on when we sit on the floor. So it's actually quite a big muscle, and the pelvic floor muscle then wraps around the passages, the front and the back passage that you have. So that is then what helps you to hold in when you need a wee. So it's an important muscle to strengthen just generally, even if you're not pregnant. But generally they say in pregnancy you want to try and strengthen and keep up with those pelvic floor exercises, as you have that additional weight of the baby and then everything that comes with that. So I'm just going to take you through a short routine that will help you to strengthen your pelvic floor, and again it's something that you can do at any point in the day. So you might just want to come back to this video and do this a couple of times a week, or it might be something that you take that technique away with you and you do it at points in your everyday life. I just want you to come and find a comfortable seated position, and from here I want you to sit right on your sit bones. So you might just want to move the flesh away from your bum cheeks and just come and sit nice and tall onto those sit bones. Come and place your hands onto your knees. And just think about your breath to start with. So normally in Pilates we breathe in through the nose and out through the mouth, but we don't want to get too caught up on the breath with this, as it might get a little bit confusing, and I want that focus to be on the pelvic floor. So you can breathe in and out through your nose if that feels more comfortable for you. And I want you to try and get yourself in a position where your head is directly over your pelvic floor. So directly on top of those sit bones. So we're not leaning too far back or bringing ourselves all the way forward. You might just want to roll the shoulders back a little bit as well. And then we're going to think about the pelvic floor. So we've got front, back and side to side. So you can almost think about those muscles as a hammock, or maybe a diamond shape that run to the 4 points. So whatever works better for you really in terms of how to visualise that. So we're sitting nice and tall over our sit bones. And then we're going to come into this pelvic floor exercise. So we're going to take an in-breath to prepare, like we normally would do in Pilates. And as you breathe out, I want you to lift through the pelvic floor. So think about lifting through the front and the back passage, almost as if you're trying to hold in a wee, and also if you had wind or anything like that. So you're trying to hold both the front and the back passages. And you just hold that for 10 seconds. Final 3, 2, 1, and then release. Take another in-breath and an out-breath as sort of a bit of a rest before you go again. And then the next time we breathe in to prepare, breathe out and lift through the pelvic floor. Now I want you to try to keep breathing whilst you're in that hold. For 3, 2, 1. Let it go. Again, we take an in-breath and an out-breath as a rest. Breathing in to prepare. Breathing out to lift and hold. Now, you might not be able to think about breathing, so if that's a bit difficult for you, try to think about talking instead. And release. We're going to go again. Inhale. Exhale to rest. On your next out breath, we're going to lift and hold. Lovely. So maybe try just saying a few words, making sure you can hold in that position for 3, 2, 1. Release. In breath and out breath as a little rest. We're going to take 5 more of these. Breathing in, breathe out and lift. Now you should find that your core muscles and your bum muscles are not tensed at this point. And release. Breathe in and out. Next time we breathe out, we're going to lift. So we should be able to keep our other muscles nice and relaxed. We should be able to talk. We should be able to breathe. Sometimes it's easier said than done, just whilst you're trying to find your rhythm with this. Last 2, 1, let it go. Another breath in and breath out. You've got 3 more. We're nearly there. As you breathe out, take a lift. So the idea is to do this 10 times. If you can, holding for 10 seconds each time. For 3, 2, 1. And you might find that your pelvic floor muscle does start to get tired. That's perfectly fine. It depends how strong that muscle is and how much work it needs. Next time we breathe out, we're going to lift. At this point, you might find you can only hold for 4 seconds, and that's absolutely fine. You just do what you can and release. We're going to take 2 more. So take your in and out breath as a little rest. Just gets the body ready again. Breathing out to lift. If you can only hold for 4 seconds, 6 seconds, absolutely fine. Take that release. And our next one is going to be our last one. So we're going to breathe in, breathe out and lift. Keeping the rest of the muscles nice and relaxed. Really focusing in on that lift. Last 2 and last 1. Release. Lovely. So on top of that, on top of your holds, it's also recommended that you do some pulses as well, because your pelvic floor is made up of both fast twitch and slow twitch muscle fibres. So that's sort of strength and endurance. So the next time we do this, we're going to take some pulses. Let's come and get comfortable again, reset. We're going to take our breath in to prepare. As we breathe out, you're going to lift and hold. Then you're going to think about pulses. So you're going to release and lift, release, lift. Pulse, 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 breathe, pulse. For 4, 3, keep pulsing, 2, lift and hold, and release. Whew. So you might find that that pelvic floor muscle is actually starting to feel quite tired now, and towards the end of that you were struggling with the holds, or maybe the pulses were getting a little bit weaker every time. That's absolutely fine. It just means that you might have that slightly weakened pelvic floor, which is totally normal. And maybe you just need to come back to these exercises a couple of times a week, or maybe try to fit them in your daily routine, you know, when you're sat on the bus or something. So I hope that was informative, and feel free to come back and watch this video whenever it works for you. See you soon.